Well, you're kind of going back to the insurance thing and insurance not potentially covering. I know in our pre-talk before we recorded this, you talked about your time at a big nameless insurance company. What was your experience like that? I know you talking about it seemed pretty negative, but what were some of the things you saw on the belly of the beast that maybe disillusioned you or disheartened you and made you frustrated with the system?
Yeah. Okay. It was a dark time. It was, I think we often as people with diabetes or anybody who's chronically ill, we often wonder what those conversations look like and why they don't have clinical people in the room when they're discussing who gets what or what we cover. And I have been in the room and listened to those discussions, and it is truly horrifying. Because it's a bunch of business majors making decisions. And again, you have, we had diabetes educators that had been diabetes educators for 20 to 30 years, a long time. And they did not listen to them or consult with them really. And so that was kind of wild that they had the resources to do that. And we were in the room, but they just wouldn't listen to us. And even if we were kind of speaking their language, we're like, well, this will help with the cost here and cut some things here. The biggest issue is just this lack of empathy and ethics. And again, that stigma that we all have, or that a lot of people have about diabetes or chronic illness in general, it really plays a part in the conversation of those oftentimes business majors that are running insurance companies and making all of those clinical decisions. I will say, if there was anything that was really dark and upsetting, and ultimately why I had to leave because it was just horrifying to kind of listen to, it was a validating experience because I got to work in a way with doctors and with a bunch of different, a multi-specialty approach. And because it was covered by insurance or by the employers, the clients were able to get unlimited help. So they had a health coach, they had me that they could see weekly or however often they wanted. They could send us messages. They had a bunch of educational resources. And so it was this is exactly how it's supposed to look. And people's health outcomes really did. We were able to get people to lower medications, but also people that needed medications, we were able to put them on so that we could prevent even more costs down the road for that person and the insurance company. So it was very, it was validating to see what that looked like, because right now clinic is quantity over quality, and it was nice to see it switched and be oh, okay, we can get everybody healthy. We just have to give, yeah. So I will say that was nice to be able to do that and to see that worked.
No, it's good to hear. It's cool to see when it actually does work. There are pockets of insurance, whether it's employer insurance or in some cases Medicare, where things just work smoothly and you're like, this is possible.
Mm-hmm.
Anybody says it's not possible, 100% possible. And you got to stop doubting it.
Yeah.